everyone, Michelle here. I'm here to talk about ECT, or otherwise known as electroconvulsive therapy. Sometimes people call it shock therapy. That's old news, we don't call it that. Sometimes people have idea that it's this terrible, horrible, painful thing, which it's not. There was a book and movie called One Flew Over the Cuckoo's Nest, where it was portrayed as something really horrible. And so a lot of people think of it that way still, but it's really not that at all. So hopefully this video will give you some insight as to what my personal experience is, because everybody has a little bit different experience and it affects everybody a little bit differently. So I'm here to tell my story and my experience with it. So the first thing, like I said, to keep in mind is that ECT is a little bit different for everyone, and depending on each person's situation, their treatment is adjusted to fit their individual needs by their doctors and their treatment team. So that's important to remember while you're watching this, that this is specifically for me. And I am diagnosed with bipolar disorder, schizoaffective disorder, and anxiety disorder. So to start off, I'll go into more detail about exactly what ECT does. I'm kind of going to try to go in order of what my ECT day is like, and try to explain in my own words, because I'm not a doctor and I'm not a scientist, but I'm going to try to explain the best I can from my understanding of what's happening. And so as I go, I'll try to be more specific as to how it works. So my glasses keep falling down, but most patients will receive 6 to 12 initial treatments initially, which usually are administered 3 times per week. After that, it depends on the patient, but many will go on a maintenance schedule, which can be weekly, every 2 to 3 weeks, or monthly, depending on their symptoms and depending on what their doctors and treatment team decide for them individually. So I know some people only get that first initial treatment and then they stop. But for me, I needed maintenance treatments. So I did those first initial treatments, and then I went to weekly, and then we tried spreading it out to every 2 weeks. I needed to go back to weekly for a while. Then I went back to every 2 weeks. Eventually I got to 3 weeks, but that wasn't working so well. And then I went back to 2 weeks. You get the idea. It went back and forth and changed depending on how I was doing and how my symptoms were. But the main goal is to try and spread out the treatments as much as possible and maintain your mental health and keep the symptoms at bay. And you do this not just with ECT, but also by medications, therapy, whatever your treatment team and doctors recommend. People do different things. So it's not just ECT, it's a multitude of different things. So today is April 23rd, 2020, and I'm currently at every 3 weeks, and I'm doing really well. So we're gonna do, I think the plan is to keep doing every 3 weeks for a little while and then try to stretch it out to every 4 weeks. So I'll be doing it monthly. And that's very exciting. So yeah, I'm gonna stop it for now, and I will pick up and we'll keep going on the ECT day. Talk to you soon. Okay, I've got my ECT outfit on, and I end up wearing the same outfit every time. It just started off that way on accident, but then as time went on, I found myself wearing the same outfit, and now I wear it every single time I go. Costco pants, black t-shirt, short sleeves so they can get the IV in, and I don't know, I guess it's just very comfortable, and I just like wearing it. So this is my ECT outfit.
You're a rebel, getting into trouble. You are kinda like a fire, like a fire, like a fire. Unpredictable.
Hi everyone. It's ECT day, and my dad and Lily just picked me up. And my dad is awesome. He has been with me at every single, whoops, Lily wants to be in the video. My dad is awesome. He's been with me at every single, almost every single ECT that I've had. And I've had over 100 ECTs in the last 4 years. And so that's pretty amazing. That's a lot of time and love that he's given me. We're here early. It's 7 o'clock in the morning, and I like to be the first appointment for a couple of reasons. Since I can't eat or drink after midnight, it's easier for me to go early so that I don't have to be hungry, because of course I'm never hungry when I normally wake up in the morning, but on ECT days I'm starving and thirsty. And the other reason is that I don't have to wait as long after they prep me if I'm first. So, oh, and there's a third reason. My dad loves to wake up early in the morning.
All right. Whatever.
So there we go. Okay, we'll be right back. So Dad, I have a question for you.
Okie dokie, I'm ready.
When did you first start noticing a difference in my behavior, symptoms, and mood after I started ECT in 2016?
Well, first of all, you have to know and remember I'm an old guy now, and I've got a really good memory. It's just short. But that said, I can tell you this. Michelle's been going through a stage that most people could it was unbearable. And she ended up, after all of the different kinds of meds that the psychiatrist had tried for her, all of the counseling that she's done, she pretty much was a zombie. She would just sort of stare out into nothing, and we would talk, but she really wasn't there. Let's see, how do I want to say it? As soon as ECT started, after just a couple of times, I could see a difference. I could see that she was in the now, where she never was for a number of months, if not years. And after a while, she would just progressively get better, but then she would fall back. But I can tell you, I would say this, that after 100 times of ECT, my little girl was back. She would converse, she would talk, she was happy, and still is. I mean, that's the way she is today. it's remarkable what ECT has done. In my mind, not only did she say it saved her life, I got to tell you, it saved my life. Because I will tell you, it's not an easy thing to go through this emotional feeling where you can't do anything for your daughter. It's a real killer. But that's been the past, and now I just see the future. She has now been able to drive. She converses all the time. She's just super now. And although I will tell you, there were setbacks, and I understand now mental illness will have setbacks no matter what. And the amount of different kind of meds going back and forth, I'll tell you, it's stressful for everybody. But she kept fighting, and I think it had a lot to do, honestly, with her mom and her stepdad, where they would always be there for her. Her mom has a gentle soul, just like me. Okay, well, not, but she would. Her mom would always keep her under check.
Hi everyone. So I've arrived at ECT, and I go in and I check in with Jay, and she is amazing. She always makes me feel welcomed, and she does everything. She's organized and checks me in and gets me all set, and just between you and me, I think she keeps that place running. And so then I wait a few minutes in the lobby. There's a small lobby, and then eventually a nurse will come out and she'll screen me for my temperature, now that we're doing this whole COVID-19 thing. And then I go into the main area, and I go to the prep side of the room, where there are 3 bays with hospital beds and all the equipment for prepping. And I first sign papers, consent papers, and then I get in bed, and I don't have to change clothes, so I keep on my ECT outfit, which you've all seen. And I get a warm blanket, and then I basically stay there in that bed the whole time for the rest of the procedure, treatment. And either Jay or a nurse will hook me up to blood pressure, heart monitor, and pulse ox. And they record that, and they will ask me a standard set of questions, how my last treatment was, if I had any issues. I usually tell them I had a headache. I used to get nauseous, but they give me something in my IV to keep me from getting nauseous, so I don't get nauseous anymore. And they ask me, they make sure I haven't had anything to eat or drink since midnight. What else do they ask? They ask me a bunch of stuff. Then a nurse will come, a wonderful nurse. There's wonderful nurses there. Let's see, Nurse T, Nurse K, Nurse C, Nurse V. I would say all your guys' names, but I don't know if you want me to. But I love them all. They're all so sweet, and they make me feel comfortable and talk to me, and we catch up since my last treatment. They all know me really well, and they will get my IV, do my IV. I always get it in the same place, my right AC, because I have a big vein that you can see right there, which is really helpful. And they always do a wonderful job. They have lots of practice. It usually never hurts, but I always count to 3. That's my trick. I just count to 3, and then that's all the pain I have to have, if there is any. And so then they start me on fluids, and let's see what else. Then I'm pretty much ready to go until it's my turn for the procedure. I keep saying I'm sorry. I wait there for a while. Let's see. Then the anesthesiologist will come and talk to me. They will do a little exam. They always make me open my mouth, check my teeth, I guess. And then they check my lungs. And I know this maybe is boring, but this is what happens. I always ask the anesthesiologist to please tell me before they give me the sleepy meds. And they always do, which is nice. I feel like it helps me orientate. Is that a word? Am I using that right? When I wake up, helps me kind of figure out where I'm at if I know right before I fall asleep. And it also, I think, gives me a little bit of control. So it helps me feel less anxious if I know before they put me to sleep. And so a lot of anesthesiologists will do that anyway, but I notice that when they don't do it, I feel kind of like I have a hard time figuring out what happened and where I'm at when I wake up. And so then a few minutes later, the amazing nurses will take my bed and wheel me back into the procedure room, which looks like kind of like an operating room with a bunch of machines and lights and yeah, it's pretty like an operating when you have surgery. It kind of looks like that. And there are always the doctor is back there, and he asks me how I'm doing and how I've been, and we have a little chat, right? And as that's happening, I'm getting prepped by the nurse who's going to be with me through the procedure. She's usually putting the electrodes on my forehead, one behind my ear, I think one on my right here. I'll have to double check that. And the anesthesiologist starts giving me pre-meds. They're not the ones that put me to sleep, but they're other meds that they give me to relax my muscles, so that when I have the seizure, my muscles are all relaxed so I don't move. And they give me something so I don't have a headache, so I don't have nausea, and some other medicine. I'm not a doctor, so I don't know exactly what they give me, although they list it off every time. So if I had a really good memory, I could probably tell you. Let's see. They start giving me oxygen. They put on an oxygen mask, so I start breathing pure oxygen. And then pretty much the procedure starts. And I will talk about what happens during the procedure in the next segment. So that's pretty much it. So talk to you soon. Hi everyone. So we're in the procedure room. I've already talked to the doctor. I've got my oxygen mask on. The anesthesiologist is letting me know that they're going to give me the sleepy meds. And after they've let me know that, it takes about 5 seconds and I'm out. I'm asleep. And as soon as the doctors are sure that I'm asleep, they start the procedure. The electrodes are already put onto me. They're on my forehead, behind my ear, and one on my collarbone right here, or right here actually. And the doctor starts. He takes a precisely controlled electric current which passes through the electrodes and induces a seizure throughout the brain, which lasts about a minute. Because I have received anesthesia and a drug that briefly paralyzes the muscles, I'm only moved slightly, maybe my fingers, toes, and eyelids. Now, I've never seen this happen because I'm asleep. And I've never had the opportunity to watch somebody else have it happen except on a video. So, but from what I understand, there's not a lot of movement. The seizure mobilizes brain chemicals called neurotransmitters. The effect is that the brain cell activity is changed, much the same way as antidepressant medications change the brain. But it works much faster, and it works when antidepressants haven't worked. So usually it's not the first line treatment. It's tried after antidepressants have been tried and haven't worked, or if somebody is suicidal and they need a quick something to be done quickly. But usually medications are tried first before ECT. At least they were in my case. I don't want to speak for everybody, but they were in my case and they weren't working. So that's when ECT was tried and worked. And I found that for me personally, medications that hadn't been working started actually working better after ECT as maintenance. So I'm doing both now. So anyway, back to the procedure. I think I'm in the procedure room for about 10 minutes, maybe 15 minutes max. Then I'm wheeled in my bed asleep into the recovery area of the main room, and I'm allowed to wake up slowly. And that's pretty much it for the actual procedure. It's pretty quick. So I'll come back and talk to you about recovery in just a minute. Thanks. Hi everyone, we're in the recovery area. There are several nurses taking care of me while I sleep. Everyone wakes up from anesthesia differently. Some wake up right away, some sleep longer. That would be me, sleeping longer. When I do wake up, I usually think that I'm in the prep area waiting to go into ECT. But soon I realize that I'm already done and I'm actually waking up. So then I usually go back to sleep for a little while. Finally, I sit up. One of the lovely nurses brings me some apple juice because my throat is very dry. And then I finish waking up and I'm ready to go home. The sweet nurses help me out of bed and into a wheelchair and wheel me out to the car in a wheelchair. And my dad is there to pick me up. And that's pretty much it. It's pretty simple. So yeah. So we'll continue on with the next segment.
Hi everyone, I just got out of ECT. I'm feeling kind of groggy, kind of tired. Other than that though, I feel pretty good. So I'll talk to you when I get home. Alright, bye.
Hi everyone, I just got back from ECT. As you can see, I'm really groggy and my throat is really scratchy. They do not intubate me, but the procedure causes me to salivate a lot. So they give me a drug in the IV that causes me not to salivate, which then dries me up very much. So for the rest of the day, I have a scratchy throat. But my wonderful stepdad always gets me a Gatorade, so I'm set. And now I'm gonna introduce you to my lovely mother, who always takes care of me after ECT. She has taken care of me since the very first treatment, and that's over 100 treatments in the last 4 years. So somebody has to stay with me for 8 hours after each treatment to make sure I'm okay. That's over 800 hours. Yes, I can do some math. But I just really love her and appreciate her. And now I'm going to ask her a couple questions. So be right back. This is my mommy. I just wanted to ask her to explain to you guys what my day is like after I get back from ECT.
Well, good question. You are usually very groggy, and I help you walk a little bit. So when you want to go somewhere, you need a little help, but you're pretty stable. You come home and you sit down in your chair and you have some Gatorade. Sometimes you doze in the chair. I usually sit next to you, read or do something else, and then you decide you think you need a nap. So we go back and you get into bed, and you usually nap for maybe an hour or two. It just depends on the day. And I keep checking on you to make sure you're okay. And then you get up, come back out, and maybe have a little lunch. You usually have something very mellow, something like soup or a muffin, nothing spicy or heavy. And then you come back and sit in the chair. You might use Facebook, you might watch a program. You're waking up much more and you're more alert. So by the end of the day, you're looking good. And then we wonder if you're going to sleep okay because you've been sleeping most of the day or sitting in your chair. Sometimes you sleep really well. Sometimes you have had enough sleep during the day, so your night is a little bit short. But basically, it's a pretty consistent kind of day after ECT treatment.
When did you first start noticing a difference in my behavior, symptoms, and mood after I started ECT in 2016?
Wow, that's a good question. When you first started, you were getting ECT 3 times a week, and then it moved to twice a week. So I think the changes were subtle in the beginning because you were getting it so frequently. But then after we stretched it out a little bit, once a week, I started to notice your depression was minimized. You were more alert, more engaged with us and with your boys. And as you stretched out your treatments to 2 weeks, we could really see a big difference. You were stable, you were engaged, you laughed, your sense of humor came back, and you parented your boys, you got more involved. And as the end of the 2 weeks, toward the end when you were getting another treatment, we could see a change to more depression. So we could see that right away you had effects from the treatment, and then as time went on, the treatment effects wore off. So it's been very clear that ECT is helpful. And now when you're at a 3-week time, you're stable almost all the way up to when you get the next ECT treatment. So we're looking forward to stretching it to 4 weeks. You're doing wonderfully. You're parenting fully. You're engaged with us. Sometimes you are so engaged you're annoying and bothersome, but
Who, me?
yeah, you telling me what to do, and that means you're back and you're normal. And so we're thrilled with the ECT. It saved your life, really.
So yes, ECT did save my life. And I just want to thank you guys for watching my video. And I want to thank my parents, my kids, my family, my doctors, and my friends. Thank you very much. I love you guys.